At 9:17 p.m., Trauma Bay 3 went still. The monitor let out one long, thin note that felt colder than the air. Dr. Elias Mercer stood at the foot of the bed, sleeves rolled, jaw set. Time of death, 21:17. The glass shook with the rumble of the L passing outside. Arden Cole watched from the corridor, hands, still wet from the scrub sink water dripping along her wrists and gathering at the cuff. A green line on the screen refused to rise. The sound of it stayed in her chest when she turned away. 6 hours earlier, snow was melting into a gray slush that soaked the front steps of Mercy Cross Trauma Center. Arden tied her hair into a neat bun and pulled a mask under her chin. The fluorescent lights hummed. The ER breathed in beeps and clipped voices. She reached for gloves at the supply cart. A thread of ink peeked out from under her sleeve, black dots, and dashes circling a caduceus. Hold fast. Mercer appeared without warning in the doorway, white coat, crisp eyes taking inventory the way they took a room. You the replacement Dr. Cole. Arden snapped the glove into place. Dr. Cole works. We have a dress code. Keep ink covered. This is not a pier and it is not Friday night. Understood. He checked his tablet and did not look up. Appendectomies today. Adeyemi will supervise. Patient in pre-op B, routine case. Think you can handle that without improvisation. Arden met his gaze and held it. I can handle it. Mercer glanced again at her wrist. He said nothing more and left her with the low chorus of monitors and the hiss of oxygen through plastic. Noah Park was restocking the crash cart near the supply cabinet. He had a squared-off stance that came from drills more than dance. His badge said RN Trauma, but the haircut and the eyes said other things too. He nodded at Arden, watched how she organized her tray. 2 passes over the syringes, same order each time. You prior service, Doc. Arden paused with a roll of tape in hand, then set it down. Why do you ask? Noah shrugged and slid atropine into the top drawer. The way you move, less waste. You count without counting. She pulled her sleeve a fraction lower. Practice. Pre-op B held a boy who tried to smile even as the pre-med made his eyelids heavy. The chart said, 20 pain started 6 hours ago, nausea, fever. Dr. Naomi Adeyemi was already scrubbed and reading labs with the anesthesiologist. She was tall, precise, and spoke with a rhythm that suggested she did not like to repeat herself. You are 2 minutes late, Dr. Cole. 2 minutes is a lot, Arden said. It will not happen again. Adeyemi held her look for a beat, then nodded toward the sink. Scrub in. This is straightforward. We do not go looking for trouble. Arden turned on the water. It came out too hot. She watched it run pink over her fingers after the scrub brush, the smell of chlorhexidine sharp in her throat. Water beaded on the glass of the scrub room window, the world beyond it bent at the edges. She dried hands held them up and backed into the OR. Lights made everything flat and honest. Drapes in place, blue fields. The boy's chest rose under the ventilator, slow and steady. Adeyemi made the first incision. Skin, subcutaneous fat, fascia. The cautery whined. The room smelled of singed hair and iodine. Arden stood opposite, eyes level with the wound mind quiet. Instruments touched palms, left them returned. Adeyemi exposed the appendix. Textbook angry. She reached a clamp. A smell rose through the mask, faint at first, then certain. Not cautery, not blood. Something sour like metal under hot rain. Dr. Adeyemi. What? Peritoneal contamination. The clamp paused midair. Scans were clean. Bodies do not always send their records to radiology. Adeyemi leaned in, saw the gray smear along the peritoneum, the thin sheen of cloudy fluid pooling where it ought not to be. She did not sigh. Hand me suction. Irrigation. Arden guided the catheter and the field opened a fraction more. She did not narrate. She pointed with the suction tip to borders that mattered, asked for a smaller retractor with a tilt of her wrist, checked for other perforations by feel and light, in a line inside her head that told her when tissue turned from sick to safe. Adeyemi watched, and when she spoke again, her voice had less metal in it. How many of these have you cleaned, Dr. Cole? Enough to know when to stop. The cavity ran clear. The appendix came free. They closed in layers. Arden's stitches on the contaminated fascia were narrow and close-tied, low and flat. Ruth Delgado, the scrub nurse, cut the ends with a smile she did not bother to hide. Clean work, honey. You do not learn that on YouTube. Arden stripped her gloves off and let them fall into the bin. I practice. ADME stripped off her own and tossed them cleanly. Those are not the interrupted stitches we teach, military habit. Arden tied off the final knot on the skin and set the needle holder down. Habit. They wheeled the boy out. In recovery, his vitals ticked neat little boxes, and he started to wake to soft questions and a warm blanket. The hallway outside the OR was cooler. The glass in the doors showed her face bent and thinner than she felt. Ruth caught up to her. 32 years in ORs had carved soft parentheses at the corners of the nurse's eyes. You smell it before others do. That is not common. Arden tucked a stray hair into her cap. You spend enough time close to infection and you do not forget. Ruth's smile was kind and then gone. Practice, sure. The resident lounge had a coffee pot that had seen things. Arden poured a cup and let it sit on the counter long enough to let the plastic tang blow off. Leo, Grant, and Maya Joe talked about a basketball game in lines, then dropped into silence when she walked in, and then climbed back into lines as if nothing had changed. She took the cup and left without a word. Noah leaned against the nurse's station, flipping a pen through fingers without dropping it. He nodded at the coffee. You know that is punishment, right? I am aware. He looked at her sleeves again. You keep it covered because he told you to or because you want to? Both. Pager buzzed. She glanced down. Pre-op needs you back in 10 for a hernia repair, he said. Another buzz louder, different tone. The charge nurse's voice cut through the room before Arden could read the message. MCI, scaffold collapse on 54th, 6 critical, ETA 4 minutes, all hands. The ER shifted in one breath. Gown snapped, gloves snapped. The doors to the bay opened wide and stayed that way. Arden set the coffee down untouched. She pulled fresh gloves and a new mask. Mercer came in fast from the other hallway, eyes counting heads, counting bays, counting units of O negative. Cole Bay, 4. Compound leg fracture, possible abdominal trauma. Keep him stable until I clear the red tags. Understood. Do not improvise. The L roared past again. The window shivered. Sirens cut the gray outside into slices. Arden rolled her shoulders once, quieted her breath, and moved toward Bay 4 with her hands already checking for what she would need. Bay 4 waited under hard light in the roar of sirens. The doors blew open. Cold slapped the room with the smell of wet concrete and diesel. Paramedics backed a gurney in fast. A man in a neon vest clutched the rails and swore between his teeth. His left pant leg was cut away. Bone flashed white through blood and grit. His pulses beat fast and thin at the wrist. Name is Evan Rios, 29, fall from a scaffold 5 meters, helmet on. Compound tib fib, complains of belly pain, pressure 90/50 and slipping. I got him, Arden said. She slid to the head of the bed and took the jaw in her palms. Airway patent. Breath sounds. She watched the chest rise uneven under the trauma shears. Left equal to right. No wheeze, no rattle. She moved to see for circulation and saw the map of bruises blooming low and left on the abdomen. A belt of dirt across the skin spoke of where the harness had caught. There was a tightness under the bruise that did not match muscle. 2 large-bore IVs, she said. Normal saline wide open, type and cross 4 units, Noah draw lactate, and page OR to warm a room. The young nurse on her right looked toward the hall. Chief said keep Bay 4 stable, wait for him to triage red tags. He can triage while we move, Arden said. She pressed gently along the left upper quadrant. Guarding. He flinched hard. She watched his face change more than she watched her hands. This is not just the leg. Noah already had the gel on the portable ultrasound. He handed her the probe without a word. The screen hummed to life in gray. She found the liver tip and the right kidney, then tipped her wrist to slide into Morrison's pouch. Free fluid pooled black in the wedge where there should have been a clean line. She moved the probe to the left. The spleen sat heavy and rough against a lake of the same black. Free fluid. Fast positive, she said. Likely splenic injury. He's bleeding. Evan gripped the rails harder. His fingers were chalked with drywall dust. I do not feel great, Doc. I know. Stay with me, Mr. Rios. The doors swung open again. Mercer stepped in, reading the room in a glance. He looked at the screen at Evan's color at the pressure cycling low and lower. Why is OR warming Dr. Cole? Because he is bleeding into his belly and getting colder by the minute. Based on what a portable scan and a guess. Based on free fluid where it does not belong. Falling pressure, rising heart rate. Guarding. Tenderness left. He needs a laparotomy. Mercer took the probe, rolled it in a small circle, found the same black. His jaw worked. He set the probe down. OR2, now. He met Arden's eyes. You follow my lead. No freelancing. Understood. They rolled. The corridor had grit underfoot, and the wheels rattled over it. Elevator doors opened like a mouth. The L rattled the glass as it passed. The OR staff met them in a well-practiced wave. Dr. Asha Nair hung a bag and ran through her checks. Ruth Delgado counted sponges. The overhead lamps made Evan's skin look the color of unbaked bread. Midline incision, Mercer said. He looked at Arden. Use suction. Retract. Keep my field clean. Arden scrubbed water too hot again. Chlorhexidine bit her nose. She watched the water bead on the window and race each other down the glass. She dried-gloved and stepped in across from Mercer. The drapes rose like sails. He cut through layers, quick and sure. The smell hit from the first lift of the peritoneum, iron and something deep. Blood-well dark, suction, he said. Arden took it and cleared a path. The cavity filled and emptied with each pass. She kept the tip low, skimmed clots, and let the brighter ooze show where it wanted to go. The bleed came from the left. The spleen's lower pole looked torn and slick like fabric ripped and soaked. Mercer placed a hand there to feel the pulse under his palm. There you are, he said. He packed with pads and exposed the edge. He tied off small vessels with quick fingers. Clamp, tie, release. He looked across the field and saw Arden ready with the next piece before he asked for it. He cut her a glance. Who trained you to anticipate like that? Good teacher, she said. She kept the retractor steady and her eyes on the edge of the bleed. A retractor is a dull tool until the person holding it understands lines. She watched the curve of tissue whiten under tension. She shifted a hair to keep it white and not pale. Mercer placed running sutures along the capsule bites, shallow and even. The ooze slowed. The color at the laceration turned from fast wet to slow damp. He paused to reassess and nodded. This will hold. Noah's voice came through the intercom from the control desk. Pressure is coming up, 100/65, heart rate down to 120. Ruth's count stayed crisp. Sponges accounted, instruments accounted. Mercer stood back a little and listened to the room breathe. He glanced up at Asha. How cold is he? Warming. Fluids at 37, forced air on. He is responding. Mercer began closure in layers. The last of the saline in the cavity ran clean. Arden kept suction like a pen in her hand rather than a wand. The fascia came together. Ruth snipped tails to a short, neat length. Arden took the skin and placed sutures that lay low and even. She did not think about why her hands moved the way they did. She let them move. Mercer watched the spacing like someone reading a line of music. Those are not the interrupted stitches we teach here. Habit, Arden said. The skin lay calm. The dressing lay flat. The monitor steadied with a steady metronome beat. In recovery, Evan opened his eyes to a light that was not as harsh and a blanket that did not scratch. Good call, Mercer said. If we had waited, we would be chasing pressure instead of controlling it. Arden nodded. He looked at her like he wanted to say more, then did not. They pushed through the doors back into the hall. The air felt cooler and sharper after the heat of the OR. Arden flexed her fingers. The scrub sink hissed in the background and someone laughed in a low, tired way. The smell of coffee that had sat too long drifted from the lounge. You read fast, Mercer said as they walked. Faster than most seniors. Where did you learn that kind of certainty? Practice. That word again. It fits. They reached the nurse's station. Noah looked up from a tray of syringes he was laying out by habit. He searched Arden's face for a sign and found enough. He gave the smallest nod and went back to lining things in rows. The intercom cracked. The charge nurse's voice was clear and close and wrong at the same time. Code Blue Trauma Bay 3. Code Blue Trauma Bay 3. Everything in the corridor tilted a degree. Mercer turned on his heel and moved. Staff peeled away from edges and headed toward the sound. Noah dropped the pen into his pocket and ran. Arden did not look at Mercer for permission. She set her half-empty cup of water on the counter without a sound and started down the hall. Her shoes hit the tile in a steady pattern. The glass at the bay doors threw her reflection back at her in a quick slice. Her sleeve pulled back a fraction when she rounded the corner. Black dots and dashes flashed and vanished. She pulled a fresh pair of gloves. She tied a new mask. She stepped into the light of Bay 3. Trauma Bay 3 was a circle of hard light. 4 people worked one body. Compressions pressed a chest that refused to answer. A bag valve mask breathed for lungs that would not take air on their own. The monitor showed a flat, quiet line with a few broken teeth that meant nothing. Dr. Naomi Adeyemi stood at the head voice, tight but steady. Continue compressions. 1 milligram of epi. Charged to 200. Clear. The shock snapped the body off the bed. The line fluttered and fell flat again. The room exhaled and started over. Arden came to the foot of the bed and took in the details in one sweep. Male, late 20s, work vest torn and wet with blood, bandages thick at the lower abdomen. The stain was dark and slow, more venous than arterial. The skin above the left hip was tense and round under the wrap. The pupils were equal. The lips had gone the color of old paper. How long, she asked. 16 minutes since collapse, said the charge nurse. 3 rounds of EP, 2 shocks, no sustained rhythm. Adeyemi looked at the wall clock. We are calling it in 30 seconds. No, Arden said. She stepped closer, eyes on the abdomen. He has a retroperitoneal bleed, likely a torn iliac artery. We are pumping blood into a space it cannot escape. The heart has nothing left to push. This is not a guess, Dr. Cole Adeyemi said. This is code. We do not chase shadows. It is not a shadow. Look at the contour on the left. The color of the blood in the wrap. The pressure that never climbs. The ECG will stay flat until you give the heart something to work with. Mercer appeared in the doorway, then moved to the bedside without a word. He looked from the monitor to the belly to Arden. He did not ask who had the room. He asked what mattered. Options. Resuscitative endovascular balloon occlusion of the aorta, Arden said. REBOA. We can occlude above the bleed, buy time to get him open. Adeyemi shook her head once. We do not deploy that in this hospital. The risk is high, the device is not stocked, and no one here has privileges for it. Noah Park had a hand on the patient's sternum. His face shone with sweat. He did not stop compressions, he spoke between pushes. I have seen it. Kandahar. It brought a Marine back from asystole long enough to fix him. He lived. Mercer looked at Arden. Have you performed it? Here. Yeah, no. Where Arden did not answer. The room was a drum. The only music was rubber soles and the hiss of oxygen and the soft thud of palms on bone. The doors opened at the far side of the bay. A paramedic filled the doorway helmet under one arm, face cut with a shallow line that had dried brown. He took one step in, saw Arden, and stopped like he had hit a wall. Cole, he said. His voice cracked and then found itself. Commander Cole. People turned. Even the room seemed to turn with them. The paramedic moved up to the rail. Jace Volkov, Marine Corps Attachments. Syria, 2018. You put a balloon in an aorta in a helicopter that was losing altitude. My lieutenant is alive because of you. Silence closed tight. Mercer's face changed a degree. He did not look surprised. He looked like puzzle pieces had aligned. Commander, he said quietly. Arden kept her eyes on the abdomen. She felt the word more than heard it. The black dots and dashes at her wrist burned a little in the heat of the room. She tasted antiseptic on her tongue. He will die on this table if we do not do this. If we do, he has a chance. What are the risks? Mercer asked. Aortic dissection, balloon migration, ischemia to the lower body, but he has no pulse we can hold. The risk is already in the room. Mercer gave the smallest nod. Do it. I am supervising every step. If I say stop, you stop. Arden was already moving. Femoral line kit. Ultrasound. Longest balloon catheter you have. 10 units O negative at the bedside. Reese's team ready to push on cue. Noah slid the ultrasound cart closer and came back to the chest. Compressors rotate, he called. Switch. A new pair of hands took over. The rhythm of the room shifted but did not falter. Arden pulled the sheet back from the groin and painted the skin with betadine in wide circles. Orange spread and glowed under the lights. She draped a field and kept the probe in her left hand. The screen showed grainy gray. She angled and found the femoral artery pulsing faintly with each compression. The skin dimpled under the needle, then gave. The blood that flashed into the hub was dark and clean. In, she said. Guide wire. She threaded the wire. On the screen, a bright echo snaked up. Iliac. Aorta. She watched the arc past the bifurcation. The wire hummed against the curve of her fingers as she advanced it. Dilator, she said. She widened the tract with firm, even pressure. The artery accepted the shape with a small resistance and then none at all. Catheter. Ruth placed it in her hand. Not the perfect device, but close. 7 French. Balloon at the tip. She wrote it over the wire and felt the markings pass under her fingers. 10 centimeters? 15, 20. She lifted her eyes to the monitor. The patient's skin had gone paler at the lips. Noah's shoulders moved with the rhythm of work that does not stop. X-ray, Mercer said. Portable. No time, Arden said. Zone 1. Above the celiac trunk, she felt the length and made a choice. She pulled the wire. The catheter sat where her mind had mapped it. Syringe. She attached the syringe to the balloon port and started to push saline. 1 milliliter, 2, 3. The pressure in the syringe changed at 4. The balloon had kissed the vessel wall and then pressed to seal. Stop compressions, she said. Noah lifted his hands. The room was very quiet. The monitor held the flatness for 1 beat, then twitched. A slow, ugly shape crawled onto the line, then another, more regular. The air in the room felt different, as if it had just figured out how to settle again. We have a rhythm, the charge nurse said, weak but present. Adiemi stared at the screen, then at the catheter rising from the groin like a straw that mattered more than all the others in the room. Her eyes were sharp and open. Mercer was already on the phone. Or 1. Vascular. Now. Simons if he is in-house. He hung up and looked at Arden. You are coming with him. We will need vascular clamps ready. Proximal and distal to the tear, Arden said. She secured the catheter hub with tape, then placed her palm on the patient's shoulder a moment. Stay. They moved as a group. The gurney floated down the corridor like a boat lifted by many hands. The wheels rattled over grit. The elevator doors opened and closed. The glass of the scrub room fogged when they stepped inside. Arden turned on the water. It ran too hot and turned her hands pink. She held her wrists under until the heat steadied into something she could use. The letters at her wrist stood out in the steam. She dried. The paper towel left small fibers that clung a second and then fell. Mercer scrubbed beside her. He did not look over. He spoke to the mirror. Why hide it? I was tired, Arden said. She counted her strokes by feel. She did not count out loud. She watched the soap trace lines along her hands. Tired of being a rank before being a person. He shut off the tap and took a towel. He nodded once. Then be both. He opened the door with his shoulder. The OR was ready. Lights bright enough to erase shadows. Dr. Asha Nair met them with numbers. Blood pressure 90/50 and climbing. Heart rate 120. Warmers on. 2 units in. Labs pending. Dr. Wyatt Simon's vascular arrived with his cap still creased from a locker. He looked at the catheter, then at Arden, then at Mercer. Who is primary? Mercer looked at Arden. Dr. Cole. I am assisting. Simons absorbed that in the time it took to tie his mask. Then he nodded. I will scrub and stand by. Ruth laid instruments with clean hands and clean intent. Clamps, fine forceps, 6 Proline double-armed. The sound of the ventilator clicked and sighed. The monitors chimed in their careful cadence. Scalpel, Arden said. The word came out level. The blade felt right in her palm. She made a midline incision from pubic bone to umbilicus. Blood rose dark and expected. She opened the fascia. She opened the peritoneum. A lake of blood slid out and found the suction. Large bore, she said. She packed with lap pads and followed the pool to its spring. The retroperitoneum bulged and then gave under firm pressure. The external iliac artery showed itself as a pale tube with a red mouth torn along one edge. 2 centimeters. Clean margins. There, she said. Simons came to her shoulder and looked. Repairable if you control flow. We will need flow back to test it, Arden said. She set 2 clamps within reach. 1 proximal, 1 distal. She kept the balloon catheter under a small curl of tape at the groin. She glanced up at Asha. On my call push 2 units quickly. He will dip. Ready, Asha said. Arden took the syringe at the balloon port and drew her breath. Deflating in 3, 2, 1. Arden pulled back on the syringe. The balloon let go. Blood burst into the field in a bright arc that slapped metal and cloth. The monitor tone went high and nervous. Pressure fell in a blink. Clamp proximal, Arden said. Her left hand landed true. Metal bit the artery above the tear. The spray sagged but did not stop. Distal. Her right hand closed the second clamp. The room tightened around the sound of suction. The spray chopped into a trickle and then a wet gleam on torn edges. The retroperitoneum sighed as pooled blood found the tubing and ran. Asha Nair called for 2 units and the pump clicked faster. Push, Asha said. 2 units now. The catheter at the groin lay quiet under tape. The field steadied. Arden breathed once and let it out. The artery showed itself like a pale cord with a mouth nicked open 2 centimeters along its side. 6, 0. Proline double-armed, Ruth Arden said. Ruth set the suture in her palm. The needle points were small enough to hide in glare. Arden planted the first stitch at the tear's apex. The needle kissed the outer wall and came out clean. She tied flat and short so the knot would not climb. The second stitch mirrored the first. She found a rhythm and let it carry her. Bite, pull, tie, bite, pull, tie. Each pass caught the full thickness without stealing space from the lumen. Metal whispered against forceps. The ventilator sighed and clicked. Asha counted the transfusion under her breath. Halfway, Mercer said. His voice was calm and placed her in the center of it. Arden did not answer. She watched for a tremor and found none. She watched for a leak and found only a slow pulse behind the clamp. The torn edge closed stitch by stitch. She set the 12th and tied. The line looked like print. No gaps. No bulges. She set the needle driver aside and looked up. Distal release, she said. Ruth's hand paused over a clamp. Ready? Release. The lower field flushed red as blood filled the artery below. The line stayed dry. No beads rose along the repair. Arden looked to Mercer. Proximal release. He lifted the clamp. Full pressure returned to the artery. The suture line held. The repair stayed quiet. Color is coming back, Asha said. Pressure 100/68. Heart rate 110. Warming is effective. Arden let her shoulders fall a fraction. She surveyed the cavity for other injury. The bowel lay clean. The bladder looked intact. The peritoneum held its shape. She placed a last pad to wick free fluid and then removed it after it came up pink. We are good, she said. Close. Simon stepped back and nodded once approval tucked behind his mask. Mercer closed fascia in a strong line. Arden took the skin. Her stitches lay low and even snug over tissue that had been moments from quitting. Ruth dropped the last count in a voice that made space for relief. Sponges complete. Instruments complete. They dressed the wound and secured the groin catheter. The balloon remained deflated and taped as an insurance that would not be needed. The beep of the monitor settled into a steady pattern. The ventilator met it in time. In recovery, Dante Morales lay under warm air with a line of staples hidden under gauze. The crisp smell of plastic gave way to the faint, clean odor of warm saline. Asha adjusted the ventilator to support, not drive. Dante's fingers twitched once at the tape on his wrist. He will sleep for a while, Asha said. His numbers are moving the right way. Adeyemi stood at the foot of the bed. The tightness that lived in her shoulders had eased without losing dignity. She looked at Arden in a way that had not existed a day ago. That was precise, she said. I have not seen it done cleaner. Arden glanced at Dante's face. His eyelashes made small shadows on his cheek. She nodded and stepped away. In the scrub corridor, the tile gave back a thin echo with each step. The sink hissed and the water steamed as it hit the metal basin. Arden filed her hands under the spray until the sting dulled. The letters at her wrist darkened with heat. Hold fast. She watched a bead of water hang from the sea of the caduceus and fall. Mercer came to stand beside her mask, off hair damp at the temples. He leaned his hip to the counter and did not look at her reflection. He looked at the empty hallway and the shadow of his own shoulders on the opposite wall. Where, he said. Arden reached for a towel and pressed it into her palms. Syria, Afghanistan. 7 years. She folded the towel with care and dropped it in the bin. She did not try to fill the air with qualifiers. You left it off your application, Mercer said. You wore another name. You kept your head down. Why? Because the work kept coming with a gunmetal taste, Arden said. Because I was tired of choosing with a clock that ticks like artillery. Because a medevac bird took an RPG and 3 people burned while I could not get free. Mercer's breath slipped once. He did not touch her. He did not say he was sorry. I read the board note, he said. It cleared you. It cleared an event. It did not clear what it did inside my head, or that someone leaked our flight path to people who never should have had it. He looked at the sink and the water still trickling down the back wall like veins in marble. He shut off the tap. The hiss died and the room grew very quiet. You did not freeze, he said. Not once. Arden watched her hands. The skin along the knuckles had gone raw. I have frozen in other rooms. He nodded like that was an answer he expected. He straightened and gestured down the hall. ICU, then. The ICU sat in the blue of artificial night. Machines breathed for the rooms. Monitors wrote their small songs. Dante lay behind glass with a blanket pulled to his ribs. A woman sat beside him with her hands wrapped in the sheet edge like a handle. Her hair was damp where snow had melted, and her lips were the color of new roses from biting them too long. Luz Morales, the name card on the chair said. She looked up when Mercer and Arden stopped at the glass. She saw the badges and stood as if pulled by a string. She opened the door with too much care and slipped into the hall. Is he alive? She asked. Her voice had sand in it. Yes, Mercer said. He will need time. He is stable now. She looked from Mercer to Arden and stopped on Arden. She had a small cut along one knuckle and a streak of blood under the nail that was not her own. You pulled him back, she said. She did not raise her voice. She did not cry. We used a tool that could hold the bleeding until we could fix it, Arden said. Luz reached out and then checked herself. Her hands hovered for a breath, then landed lightly on Arden's sleeve. Thank you, she said. The words came from a place below language. I told him not to let them take the bar off. He said it was faster. She took a breath that wobbled and then held. Thank you. Mercer stepped back to give them space without saying he was doing it. Noah came off the elevator and stopped when he saw the 3 of them. He lifted his chin at Arden and then lowered it again as if tucking the moment into a pocket. A figure in a dark suit turned the corner heels quiet on the waxed floor. Dr. Helena Strauss wore a badge that opened doors without being scanned. She took in the glass the bed beyond the woman in the hall holding a sleeve. She inclined her head to Luz with respect rather than pity. Ms. Morales, I am Helena Strauss, Chief of Medicine. Your husband is in good hands. Luz nodded and stepped back into the room with a small apology as she slipped the door closed. Strauss faced Mercer, then Arden. Her gaze did not skate. It placed. Dr. Cole, she said, or Commander Cole, if we are to be exact. Arden did not flinch. Doctor's fine. I reviewed your service record, Strauss said. The real one. The numbers are significant. The citations are clear. So is the gap in what you submitted to us. Arden held her eyes. I wanted the work to be the point. It is, Strauss said. And the work you did tonight is why I am here. She looked at Mercer. He sent me a message before the OR doors closed. He rarely wastes my time. Mercer did not look away. She saved him. Twice. Strauss nodded. Then she turned back to Arden and set the shape of her offer with the same economy Arden had used at the table. I want you to build a trauma training program and lead it. Full privileges. Autonomy and curriculum. You will establish protocols for high acuity cases, and you will teach them. 3 conditions. Ruth and Asha had come by and stood at a respectful distance. Noah leaned his shoulder to the wall and listened with his eyes on the floor tiles. What conditions? Arden said. First, Strauss said you stop hiding. Your record is part of your file. No more corrections in small print. Second, we expand our care pathways for veterans, and you help build them. Third, you see a therapist who specializes in combat trauma, and you keep those appointments. Mercer kept still. He seemed to shrink and then anchor as if drawing a line under what had just been spoken. Arden looked through the glass at Dante. His chest rose under the blanket. The monitor drew green hills and valleys. Luz held his hand with both of hers as if it might drift if she used only one. Arden looked down at her own wrists. The dots and dashes were darker in the ICU light. "All right," she said. Strauss's jaw unlocked a degree. "Good. The board will have my recommendation by morning." She offered a hand. Arden took it. The grip was warm and exact. The elevator chimed distant and soft. A housekeeping cart rolled by and left a clean line on the floor behind it. Noah pushed off the wall and headed for the desk to sign his notes. Arden stood a moment longer by the glass. She watched a breath and another. She let her own match it. Mercer stopped beside her without a word. The two of them looked like reflections that had finally lined up on one pane of glass. The intercom cut the quiet. Trauma alert. GSW to chest. ETA 4 minutes. All available to ER. Arden turned. The hallway carried the urgency like a current. She pulled a fresh mask from the box and looped it. Her fingers did not shake. Her steps found the tile in a steady count. The L roared outside and the windows trembled in their frames. The ambulance backed up to the bay and the doors flew open. Cold rode in on diesel and siren echo. Paramedics slid a gurney out at a run. The patient's lips were blue at the edges and his shirt was cut away to show a wound under the left clavicle. A Marine Corps globe and anchor sat in black ink on his shoulder. Single GSW to left chest. Entry only. Breath sounds absent on the left. Pressure 90/60 and slipping, the medic said. Name, Arden asked, already reaching for shears. Ryan Mitchell, the medic said. 25. Arden cut the shirt clean. The left side rose less than the right. The trachea sat midline. She pressed between ribs, found the space, and marked it. Chest tube kit, she said. Lidocaine. 10 blade. Curved clamp. Noah Park was at her elbow. He set the tray with the practiced calm of someone who had found a home inside storms. Lidocaine in. Incision. The knife whispered through skin. Dissection. The clamp pushed between ribs and the pleura gave with a soft pop. Air hissed out under pressure. The smell was faint and metallic. Arden guided the tube in and watched fog roll through it with the ventilations. Sats climbing, Asha called. 82. 88. 93. Better, Arden said. She palpated along the path of the bullet. The left chest filled darkly on the portable film. The shadow near the subclavian line looked wrong in a way a classroom never teaches. She traced the outline with one gloved finger under the skin as if the vessel could answer. The pressure dropped 2 points in the time it took to look at the monitor. He is bleeding from the subclavian artery, she said. We go now. Mercer had already stepped to the head of the bed to lead the push. The corridor took them, and the elevator opened like a held breath. In the OR, lights poured down hard and clean. Asha read numbers in a steady cadence. Dr. Wyatt Simons turned to scrub with the movements that made space for speed without losing precision. Arden scrubbed. The water ran hot over her fingers, and the smell of chlorhexidine rose sharp and chemical. Beads gathered on the glass and fell in thin lines. The letters at her wrist stood out dark and simple. Hold fast. She dried and gloved. In her palm the scalpel sat like something remembered. She opened the chest with a transverse incision under the clavicle. The muscles separated. The field filled slowly. Retractor, she said. The edges lifted. The subclavian lay there nicked along its side by a bullet that had passed like a thought and left a torn whisper behind. The wound oozed bright and steady. Clamp proximal, clamp distal. The blood slowed. 6 Sonero, Proline, double-armed. The needle took tiny bites that matched along the edge, bite-pull-tie. The line closed the mouth of the wound into a thin seam. She released the distal clamp. No leak. She released the proximal. The line stayed dry. Pressure is 102/68, Asha said. Heart rate 108. Warming is good. Arden closed muscle and skin with small attention. The stitches sat low. The dressing lay flat. Ryan's chest rose with the ventilator while the monitors drew neat green hills. In recovery, his fingers flexed once like someone held by a current who had found a rock. 2 weeks later, the simulation lab on the 5th floor filled with a different sound. Not sirens, not codes. The soft whir of high-fidelity mannequins and the crisp commands of residents who were learning to make decisions without apology. Through the one-way glass, Arden watched a 4-person team move through a staged mass casualty. Leo Grant called triage with fewer wasted words than he used a month ago. Maya Joe placed a chest tube in plastic skin and watched the numbers respond. The room on this side of the glass stayed dim and cool. A notebook lay open on the counter. Arden's lines in it were short and exact. Dr. Burr. Naomi Adeyemi stood beside her with arms crossed and a face that had found new lines since winter started to break. "They are faster," she said. "They are listening to the room," Arden said. Noah walked in with a tray of airway kits for the scenario and set them in a neat row. He glanced at the glass. His reflection crossed with Arden's in the pane, two outlines that met, and then separated as if the window were a sheet of water. The pager at Arden's hip stayed quiet. Strauss had made good on her word. Full privileges. A sign on the lab door read, "Mercy Cross Trauma Training Program." The font looked nothing like a banner and everything like a label on a tool. Dr. Helena Strauss found Arden between cases later that afternoon and handed her a thin folder. There were 3 letters. The paper smelled faintly of toner and someone else's office. Pentagon. FEMA. European Union Medical Coordination Office. Each line of each letter was precise and heavy. Requests, not orders. Strauss did not fill the air with adjectives. "You have built something that other people are watching. That is all." Arden nodded. She set the folder on the counter and let her hand rest on it a moment. She could feel the texture of the paper through the glove. She was back in the ER when her phone buzzed against her thigh. A number she did not know. The text came with a photo, a beach the color of tea in low light. A man in a cap kneeling in the sand while 2 little girls in pink jackets packed a bucket. The man's smile was tired and full. "Evan Rios," the text said. "The girls wanted to send this. Thank you." Arden stared at the sand stuck to small knees. The horizon line sat level and calm. She typed back with one thumb. "Live well." She put the phone away and stood for a second with her shoulder against the cool wall and listened to the building. Snow thinned outside. Slush ran in shallow rivers into drains that swallowed it without comment. The L rattled past, and the rails sang in a way they did only when the wheels hit just right. The city smelled like wet iron in spring trying to push through salt. Jace Volkov showed up in street clothes with a cup of coffee that did not taste like punishment and passed it to Noah with a look that said, "Share." He found Arden near the nurse's station. He tapped the edge of her badge once with a forefinger. "Commander," he said, quiet enough that it sat between them and did not travel. Then he smiled and pointed at the letters there. "Dr. Cole." He was not correcting. He was noting what had become true. She let the breath she had been holding since the day of the scaffold collapse slide out in a line she could not see. 6 months after the winter had cracked, Arden stood at a long table in a room in Washington and laid out a curriculum. The slide on the screen showed a flowchart that did not bother with ornament. Competency assessments. Bridge modules for combat medics. Translation of skills into civilian protocols. The faces across from her watched without checked phones. A colonel in the back row had forearms thick with rope veins and a pen that did not move. When she finished, he stood and brought his hands together. The sound filled the room and drew others with it. She did not bow. She nodded once and unplugged the cable. In the hallway, Jace leaned against a column and waited. He did not say congratulations. He looked at her wrist. He could see the dots and dashes at the edge of her cuff. He gave a small nod like someone marking a waypoint on a map. Noah texted a photo of the lab back home. Maya and Leo bent over a mannequin with expressions that belonged to people who no longer flinched at the shapes of hard choice. Chicago opened its lake air when she stepped out of O'Hare later that night. The wind blew straight and honest. The road back in flashed white lines that ticked under the car. At Mercy Cross, the front steps were wet but not icy. A janitor dragged a mop down the corridor and left a clean strip that gleamed under the ceiling lights. It looked like a river cut with a ruler. Arden stopped at the scrub sink before walking the floor. The water ran warm for once. It slid over her hands and turned pink where a small cut from a loose staple gave up what it had to give. She watched the stream carry that color away. She looked at the glass and saw her face in it, then looked past it at the hall. The letters at her wrist stayed dark no matter how the water ran. Hold fast. The monitors beyond the glass traced small mountains and valleys in green and amber. A ventilator sighed and clicked. Someone down the hall laughed once in the way people do when fatigue loosens a knot. Arden turned from the sink and walked the line of the bays. She looked in where the curtains were half open and checked drips and dressings with the calm of someone who trusts what she is seeing. She stopped at a door and watched a man sleep with a line of staples under gauze. Ryan Mitchell's marine tattoo showed at the edge of the blanket. A plastic soccer ball sat on the chair. It had a little dirt on it that looked like a field worth returning to. Back at the nurse's station, Mercer signed an order and set the pen down exactly on the line where the paper asked for it. He glanced up. Their eyes met and held for a breath. He did not nod. He did not need to. The intercom announced a transfer from a community hospital with the neutral voice that had no idea what waited inside other people's nights. In the distance, the L rattled over steel and the windows trembled. Arden pulled a fresh mask and looped it without looking. Her hands knew the motion. Her feet found the tile in a steady count. In a city with lines for everything, rails and roads and wires and sutures, and the green thread beating across a screen, she stepped into the next pool of light. The air smelled clean. The sink hissed in the background. The letters at her wrist did not fade. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts, so feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.